Hi, everyone. Welcome to today's session. We're going to give folks a few minutes to dial in, and we'll get started in a few minutes. Great. Well, we'll go ahead and get started for today's session on strategic text messaging to support underserved patient communities during COVID-19. So welcome, everyone. We're excited to have you all here. Just going through our agenda briefly, we're going to do a little bit of a background on CareMessage, a little bit of what our Lite solution looks like, and we'll kind of do a walkthrough of that solution and how you'd be able to use it. And then we're going to hear from Whitney Reed from Access Health on how they use Lite. And then we'll also hear from Wes Keys from Brother Bill's Helping Hand on their use of CareMessage as well. And we'll have a brief Q&A at the end, so feel free, if you have any questions throughout the presentation, feel free to either use the chat, or you'll see there's a Q&A button towards the bottom of your screen. Either way works for us to see your questions. So please ask any and everything. We would love to have you ask any questions. And now I will go ahead and hand things off to our first presenter, Christine Chang from CareMessage.
Thanks, Jess. Good afternoon, and hi, everyone. Thank you for making the time out of your busy schedules today to join us for our Lite presentation and how we're supporting organizations, specifically safety net organizations in Texas during this time. I will dive right in. I know we've got a packed agenda and want to save as much time for Whitney and Wes to share their experiences and work. For those of you who don't know us, we are CareMessage. We are a 501c3 nonprofit organization building healthcare technology, specifically patient engagement solutions for safety net providers. We were founded in 2012, and to date, since then and to date, we are the first and only patient engagement platform specifically designed to engage and reach underserved patient populations. And thus, through our mission and focus as a nonprofit, we work with close to 300 safety net organizations across the U.S. That, of course, brings us into partnerships with federally qualified health centers, community health centers, free and charitable clinics, health-centered control networks, and PCAs as well. We'll talk a lot about our COVID-19 response as an organization, but to date, and since March 2020, our organization has helped facilitate the sending of over 16 million messages related to COVID-19 across over 220 organizations using both our free solution and our paid solution. We are extremely proud to work with organizations already in Texas. We've listed a few of them, down below here: Lone Star Circle of Care, Los Barrios, Arthur Nagel, CHC of South Central Texas. So thank you to those organizations. If any of you folks are dialed in, and others who are already working with us, and we look forward to potentially getting to meet and work with more. In addition to launching the free COVID-19 version of our full platform, a part of our COVID-19 response as an organization was to launch Project Equity, which is a continued and concerted focus that we have, excuse me, taking a sip of water, a focus that we have as an organization to reach safety net providers, specifically those serving Excuse me, thank you for that. I have quite a tickle in my throat. Specifically those serving patient communities of color, specifically Black or African American, Latinx, Native American, American Indian, Alaska Native, or rural and migrant communities. Our goal is to reach those organizations specifically because their patient populations have been disproportionately impacted by COVID-19, and we want to make our free solution available to those organizations to reach their patients. Without further ado, I'll dive into CM Lite and what this solution looks like. CM Lite is a version of our full platform and focuses on two types of patient communication. The first is the ability to reach patients at scale, so sending a single message out to hundreds or thousands of patients through our group outreach feature. So this can be used for letting patients know about best practices related to hand hygiene, social distancing, testing availability, clinic closures, letting patients know that your organization is transitioning to telehealth. These are bi-directional messages. And then the second functionality is direct messenger. So the ability to send a single message, to send and reach patients on a one-on-one basis. We're seeing today that a lot of our users are leveraging direct messenger to have those one-on-one conversations with patients via SMS for care coordination and care management. CM Lite is designed intentionally as an unintegrated solution, and this is because we wanted to give safety net providers the ability to get started with our platform within a matter of days or hours of logging into CM Lite. And in addition to the actual functionality, we have created and continue to develop our free messaging library. And regardless of if your organization uses CM Lite or CareMessage, this message library for COVID-19 related messaging is free and accessible to any safety net provider. During the demo, we'll go through the workflow of how our health center partners are using CM Lite, specifically through the use of our file center to upload patients into the platform, to schedule different campaigns, and what the direct messenger looks like. So I won't spend too much here, but I'll conclude by saying that CM Lite is truly a free solution for any safety net provider. This is possible through the philanthropic support of our donor partners, inclusive of Johnson & Johnson, who have made it possible for any safety net provider to use this platform for a minimum of 60 days. There's no long-term obligation or commitment for any user of CM Lite to purchase the CareMessage full platform. I made mention of the free and public library that we've made available and that we update on a bi-weekly and tri-weekly basis to ensure that our content is relevant to as the landscape around COVID-19 has changed, as health centers have taken on additional challenges and want to provide regular and up-to-date communication. The two examples that you see here on the slide are actual anonymized examples of the types of messages we've most recently have seen our partners sending. We know that it's important right now for health centers to communicate to their patients that it is safe to come into the health center, that they are taking additional measures for cleanliness and safety, and that if you are perhaps, for example, out of compliance with a screening, you should be coming in and that you should be scheduling that appointment. So I wanted to make mention of that, as these are some really recent examples and challenges that our partners are taking on and addressing via CM Lite, as well as being able to connect their patients to resources. We've seen many of our safety net partners forge community relationships with, or already have these relationships in place with community-based organizations for food distribution, housing assistance, legal assistance, and it's important to them to provide those resources to their patients as well. Made mention of the importance of using CareMessage both bi-directionally as well as to send out regular updates to your patient population. And so this is an example that we'll also explore in the demo environment of how our health centers use the bi-directional multiple choice messaging with group outreach, and this is included in CM Lite, to ask patients or let them know, first and foremost, our organization now supports telehealth. Which of the following telehealth methods do you prefer? As we know that it's really important to understand what technology a patient prefers or has access to in order to implement telehealth successfully, and to identify those who perhaps might not have that option available to them. With that, I will go into the demo. And I'll go ahead and log into our demo environment, and all the data that you see here is fake patient data. My environment here is a full platform environment, and so I'll highlight the Lite specific functionality, starting with how all of our users get started, which is getting their patient information into the platform. As mentioned earlier, Lite is intentionally designed as an unintegrated solution to provide flexibility and immediate use of our platform. And so our health center partners use the file center to upload their patient lists into our platform. And that would include patient demographic data like their first and last name, language preferences, their mobile phone number, and other data that you might have from a file extract out of the EHR or population health management solution that you're using. And upon uploading your file into the file center, you'll have the option to create a group based off of the patients in that file. And so this is extremely powerful because it allows our health center partners to reach cohorts of patients depending on how you've actually pulled that list. And then you'll always be able to review your entire patient population here in the Patients tab of Lite. Once you've uploaded your patient population, you can begin scheduling and setting up different types of outreach messages. I've navigated over to Outreach, and so this dashboard gives us a high-level understanding of all the messages that we've historically sent, campaigns that we have actively running, as well as messages that we'll schedule for the future. Upon clicking into a specific campaign, you'll see that, and one that's been completed or active, you can see the messages that we have scheduled to send out, the total patients we're reaching, the response rate, the retention, and then most importantly, being able to click specifically into the patient list of who we were reaching, and being able to see, how are patients responding, filtering by those responses, and potentially even flagging and identifying patients who didn't reply with a yes/no response. This is incredibly important because we know that right now, our Lite users are reaching hundreds or thousands of patients asking yes/no questions, multiple choice questions. And in those instances, should a patient respond with something unrecognized, we want it to be easy for you to highlight and identify those patients with our filtering. To set up an outreach, we'll go ahead and we'll create the outreach, or click that button in the top right-hand corner. We can select either a group that we created through the file center upload process, or by selecting and creating a cohort directly in this picker. And then upon selecting the patients we want to reach, we can then either select a template. CareMessage or Lite comes loaded with 8 messages, or you can, of course, copy and paste those messages from our library as well. In this case, I'll go ahead and I'll select the template that we have. Perhaps I want to customize the message or craft an original message on my own. That's always a possibility with Lite. And then from there, I can schedule the date and time for this message to go out. In addition to being able to reach hundreds of thousands of patients through group outreach, we also have included direct messenger in the Lite offering, which is the one-to-one patient communication. In this example, you'll see that this is a direct conversation between the patient and the health center for any type of care coordination or management. or any conversation and topic that you should be having one-on-one with your patients. This concludes the CM Lite demonstration, and I'll navigate back to our presentation so that you all can hear from some of our users, but please feel free if you have any product questions to add them to the chat or to the Q&A, and happy to address those later on when we get to that portion of our webinar. With that, I'd love to introduce Access Health. And Whitney, if you want to go ahead and unmute yourself and introduce yourself, that would be awesome.
Hello, everyone. Again, my name is Whitney Reed. I'm with Access Health. I'm the Patient Access Manager here. A little bit about my organization. We've been using CareMessage for an impactful 4 months now. We're located in Fort Bend County, Texas. We're a federally qualified health center in Fort Bend County, and we have 5 medical sites and 11 WIC sites. Fort Bend County is actually considered the most diverse county in the United States. It's one of the fastest growing counties in the US. And our population size is about 765,000, which is projected to reach about 1 million by year 2025. And as a community-based health center, we serve populations with limited access to healthcare. In 2019, in between our 5 medical sites, we serviced over 20,000 unduplicated patients. We have several programs in place to address social determinants of health. And Fort Bend County actually does not have a hospital district, so we serve as a safety net to the county to provide healthcare services. We receive our funding through local government grants, patient service revenue, state grants, private foundation support, fundraising events, and federal grants. And the reason why we started using CM Lite was in response to the pandemic, actually. We partnered with Fort Bend County, our county, to offer COVID-19 testing to the community. And we started off with 1 testing site with the capacity to see about 250 pre-registered patients a day, which very quickly grew to 5 testing sites with several mobile pop-up sites throughout the county. So as you can imagine, our call volume greatly increased, and we had an emergent need for our phone operators to move quickly and effectively to serve as many patients as possible. And there just wasn't enough hours in the day. So to keep everybody organized and to keep our patients organized, we needed a quick solution to provide patients with their testing and confirmation numbers, arrival times, addresses for the various sites, instructions on what to bring to their appointments. And to date, we've actually tested over 30,000 patients, and we're still able to offer 1,000 tests a day. So we began using CM Lite shortly after getting started with the testing sites, specifically the messenger feature. And we used it as a way to get direct information to the patient's cell phones. We were trying to use email, and it just wasn't the best choice. So again, our primary use is outbound messaging, and we have nearly 60 staff members who are registered through the platform to be able to send these messages, and we've had 0 connectivity issues, might I add. We have also used the outreach feature that was just talked about. We specifically use that feature for telehealth appointments to notify patients that telehealth appointments are available, facility hours changes, service offerings, and site changes. My personal favorite part about CM Lite and from an operations standpoint is the ease of use. We saw a noticeable reduction in our call volume from using the messenger feature. Patients didn't have to or didn't have the need to call back and request that confirmation number or the directions, because they had it in their cell phones at their convenience, right? So very quick implementation time. I believe the implementation time was less than 24 hours for us. It's a very user-friendly platform. The message library is awesome, which was really nice because I didn't have to spend a great deal of time coming up with beautifully crafted messages to send to our patients. They were already available to me, and they were available in English and Spanish. And the outreach feature specifically has the option to set up date and time messages that can be automatically sent out to patients without you having to go in and remember to hit the button. CareMessage platform does it for you. I'll also mention that there's plenty of assistance. I myself reached out several times to find out best practices. and to make sure I was using the platform with the correct functionality. So that was great. There was plenty of help available. And at this point, I kind of consider myself an experienced user of the platform, and I'd be more than happy to answer any questions that anybody may have. So again, my name is Whitney Reed. My email address is wreed, last name is spelled R-E-E-D, at myaccesshealth.org. wreed@myaccesshealth.org. And I'm wishing you all the best. Thank you.
Thank you so much, Whitney, for such a great summary of the work that you all are doing with CM Lite, and we are so proud to be partnered with your organization during this time. I'd now like to introduce Wes Keys from Brother Bill's to share about their use of CM Lite.
Hello, everyone. My name is Wes Keys. I'm Executive Director of Brother Bill's Helping Hand, located in West Dallas. We serve the areas of West Dallas and Oak Cliff, if you're familiar with that part of our city. Brother Bill's is a 76-year-old organization. We're a faith-based organization, and we try to enrich the lives of men, women, children in the community of West Dallas and beyond. We do empowering through learning, encouraging through relationships, and ensuring the essentials of life, which that word essentials come to mean a lot more for us and all of us during this ridiculous time. But the real thing for us in using CareMessage was realizing that we were not very efficient in what we were doing. The first thing that comes to note is that, as you can see there on the bullet point, we were using one employee to make about 1,200 phone calls every, monthly. We're making 1,200 to 1,500 phone calls to our neighbors to remind them about their grocery appointments or their healthy living classes or a number of different things. Now, the way we use CareMessage is a little bit different because inside our EMR in our clinic, we actually have a messaging system. So we didn't have that same messaging capabilities for the rest of our programs, which most of those people are patients too in our clinic that come to get groceries or come to our programs or what have you. And so we needed a tool to help us do it. And so we started looking at different things. And my clinic manager, Ivan, was at a conference and heard about CareMessage, got the card, and then we've been in love with it ever since. But during COVID-19, as you can see on the bullet point there, about 30% of our patients we kind of lost due to lack of connectivity, but not just patients, but our neighbors as well that were coming to get groceries. And so what we did was we used CareMessage to really reach out to them because we weren't able to reach out with them with the physical touch that we're very, very accustomed to at Brother Bill's. We like for our neighbors to come in and to tell us what's going on in their lives, the good, the bad, and the ugly. My daughter's having a quinceañera next week, or my husband got a promotion at work, or dad's cancer came back, or the lights got cut off. We hear all those things at Brother Bill's, and then we're able to help our neighbors. We weren't able to help our neighbors in that way, but what's more, we weren't able to talk to them and to tell them about the programs that are going on because we really didn't have any mechanism to do that until CareMessage came along and allowed us to reach out to our neighbors. One thing that we realized is that everyone had a cell phone. Now, it may have been a Metro PCS cell phone with limited minutes. It could have been a Cricket wireless cell phone, but they had a cell phone and they were using it to get on Facebook. They were using it to text. They were using it to get on Instagram. They were using it to make phone calls. They were using it as their computer because many of our families who suffer from poverty, they still have to have that connectivity point. So a little quote I had over there was, the number one thing I'd love for everyone to stop doing is to underestimate our clients' ability to use technology because they use it every day. CareMessage reminded us of that. And so what did we do? We put up our registration for our grocery store instead of having to come into our actual physical building and do it. We protected our neighbors, let them do it on their telephones. They registered, and then we had their telephone numbers, and then we're able to send out messages to those neighbors. As a result, we've gained probably 200 new families, and we increased our outreach quite a bit. During June alone, we've given out just under 125,000 meals We've during the COVID crisis, once this started, we've given out countless meals to our families, and it's just been a great blessing to us to have this opportunity to outreach our neighbors immediately. For example, sometimes somebody will come in with an 18-wheeler full of food, and we're not able to really get the message out before. We're going to get the message out to our neighbors. How do we do this? We've got all this food, it's going to go to waste. Well, what we did is we sent a care message out to 900-something families that were in our database, and we had blocks and blocks of cars coming to get that food, and we were able to distribute it and make sure no food went to waste, and then our neighbors got food they needed in their homes. The other thing that's been very helpful for us in this is that at Brother Bill's, we are a faith-based organization. But as I mentioned, we wanted to know those different things about our neighbors so we can pray for them. But more than that, just so that we could connect them with different resources in the community to help out their needs, their hopes, their wants, their wishes, all the different things that they had in their lives that were going on. And so when we can send CareMessage out, and we ask them a question on there, and then they respond with their prayer requests, with their needs. We've learned about families who are dealing with COVID in their own communities, in their own families. We've learned about other health-related issues that are going on. We've answered questions. We've prayed for a million different things, and we're able to get that stuff still out to our folks and able to populate our newsletter with the information about our community. We also can do some surveys here, and so we've surveyed patients about asking about their comfortability of coming back to our programs. We found out that 80% of our moms and dads weren't comfortable with in-person programming this summer, and we figured that was the case, but we just wanted to make sure and ask them and let them have that kind of power to dictate what we're going to do this summer. And so we found those things out. We also can ask questions about what kind of appliances do you have in your house, so we can tailor make some recipes in our grocery store for folks that may not have access to a stove but do have a microwave. All of this has reminded me that our neighbors have access to technology, and we've really got to make use of it. And CareMessage allows me to ask my neighbors in real time questions. Another great thing that we have is people can message us directly back. We have inside our messenger, we're able to answer those questions really easily, and it's been a real blessing for us. In the future, we want to continue to look at these social determinants of health and continue to survey our neighbors, asking questions, and especially during this time of COVID, where we can't have pen and paper or kiosk within our building, we can still ask these questions and still get data, which is really important, of course, for grant writing and all those things in between. Also, in the future, we're going to use CareMessage. Probably wasn't intended to be used this way, but we're going to use it for volunteers. We really need sometimes to blast out something to our volunteers, like, "Oh, the event is canceled, it's raining," and we can do that immediately because we don't really have any other system to do that other than email. Emergency messages also for the community is something that we've looked at using. If our grocery store is going to close down, or in light of our clinic, we've had 3 of our MAs and our clinic coordinator all came down with COVID, so we had to shut our clinic down for 2 weeks, and we need to get that information out. So we're able to do that via CareMessage. Also promoting, as I mentioned, technology. Our neighbors are using it. We have found that our neighbors go to Facebook, they look at our post, they're getting informed by our website, and as well as our online programming, which we've had to shift everything onto online programming. Well, in order to get those people to come check out your website, you've got to connect with them. And how do we connect with them? We can do it through Facebook, but a direct text message is going to make sure we hit everyone. And it has just been a blessing for us to embrace CareMessage and really start using it in a real powerful way. Before COVID, we were reminding people of their appointments with it. But then when this all started to happen, I got with my staff and I said, "Guys, this is the tool that was created for this pandemic. What are we going to do to use it?" And our team has been using it, and it's really helped out our ministry. As our first presenter said, if you have any questions about CareMessage and how we've used it at Brother Bill's, we'd be more than happy to speak with you. My email address is wes.keys, that's K-E-Y-E-S, wes.keys at bbhh.org. Brother Bill's Helping Hand, but abbreviated BBHH. Thanks again for coming and tuning in, and if there's any questions, I'd be happy to entertain them.
Thank you so much, Wes, for sharing all the examples of how your organization has used CareMessage and CM Lite during this time. And thank you both to Wes and Whitney for joining us today, for offering up their insight, as well as the ability to connect with them later on should you have any specific questions. We will conclude the presentation and move into Q&A. And before I do that, I did want to share out just a resources page, and this deck and webinar recording will be emailed out to all attendees and registrants later on today or early tomorrow. And included in that will be the links to a lot of the different resources that were mentioned, not only to our website, but to the free resources and library. The message library offered in English and culturally relevant Spanish translations written at a 6th grade reading level or below. Whitney made mention of Access Health using this library to easily get up and running with the messaging. And then our telehealth video library, which specifically are recorded instructions for how patients can use telehealth solutions like Doxy.me or Zoom, again, offered in English and Spanish on our free and public YouTube channel. With that, I will open it up for questions. Please feel free to use the chat, the Q&A feature, and do let us know if your question is for Whitney and or Wes, and we'll be happy to address those. We have one question from Tommy Knuckles, and the question reads, how does HIPAA fit in with patient information and privacy? I would be happy to actually take that question, and to support that response, I will go into actually our Q&A and our FAQ. So CareMessage is a HIPAA compliant and cloud-based service. We're hosted on Google Cloud Platform, which is also a HIPAA compliant service. As far as, and specifically, and Tommy, feel free to follow up via chat if you have any questions around patient information. I believe the question is likely around PHI and how our health centers think about sending information out to patients. So with CM Lite specifically, and with CareMessage, our full platform, though SMS is not itself an encrypted form of communication, we work with our partners through the content that they send in order to appropriately and accurately update their patients without compromising patient information and privacy, and of course, without transmitting PHI. So an example of what that looks like right now is we have CM Lite users wanting to let patients know about their COVID test results. And so it's every health center's ultimate decision and at your discretion to decide what you're comfortable sending. But many health centers do opt to let patients know your test results are in. Can we call you to discuss those results, or perhaps only communicating negative or normal results via text message? And so using the bidirectional messaging is a great way to let patients know that you have important and potentially private information to share, and using text messaging to coordinate either via the outreach messaging or the direct messenger for that communication to your patients. We have a question from Kathy Robinson. Are languages other than Spanish supported? Officially, CareMessage offers, and the reason why we say that we officially offer English and Spanish is because all of the translations of English messages or messages written in English into Spanish are done so by our in-house dedicated translator who we have had on our team for many years now. And so we officially only say that we support those languages because we have the in-house translation services. However, many CareMessage users and CM Lite users do use our platform to send messages in other languages such as Vietnamese, Korean, Chinese, again, in different alphabets as well. And we can certainly recommend what those workflows might look like to ensure that those messages go out successfully.
I do see a question on here regarding how clinics are using to survey the patients. I didn't know if I can answer that, what we're doing.
Yeah, please. Was just opening up the Q&A, so please, Wes, go ahead. And the question does ask from Holly, how are clinics utilizing CareMessage to survey their patients?
And I know you had a slide on here that talked about different options that you can go through, A, B, or C. I don't know if that's kind of what we're doing. And what we do is we ask the questions, and sometimes you have to ask, you know, you can ask a text question and it will actually come back to you. You can ask, are you using, if you didn't, for example, we want this question a lot because we're trying to prove that we're really helping out some of our hospital systems. So we'll ask the question, if you didn't use our clinic, would you go to Baylor, Methodist, or something else? And so they can actually type that in. It'll come back to us to type text. So whatever they type is going to come right back to you, and so you can use that. And then also you could use it for a survey, a Google survey that you may have, and you can link, send a link out, and so that website or video or whatever, it'll link it, and then you're able to then do the survey there. So that's a couple ways that we've already started using it.
Wonderful. Thank you, Wes, for sharing that specific example. We have a question from Byron on what the monthly costs are to use CM Lite. And I'll scroll through the presentation again. CareMessage Lite or CM Lite is a free solution. There are no monthly costs to using this solution. And this is made possible through the philanthropic support we've received from organizations like Johnson & Johnson. For further clarity, the CM Lite solution specifically is not a 12-month commitment and 60 days of it are free. There are no costs that kick in after 60 days. And as mentioned on the slide here, we don't even collect a form of payment from our users when they're signing up with CM Lite. Now, we did have a question from Jesse around for the paid version of CareMessage, or full platform as we call it, is the cost based on the number of messages sent or something else? And so the way that our CareMessage full platform solution is priced is it's an annual subscription based off of the organization's total patient population. We specifically do not charge per message or per user because we ultimately had heard from users that, and heard from health centers that when they use solutions that are priced that way, it inhibits the organization's ability to send multiple messages out to their patients. And we're limited to only potentially sending appointment reminders because the cost to send messages around things like clinic closures, local resources that are available, you know, the use cases that Wes described around food availability and sending those regular timely updates would otherwise be cost prohibitive in a per message cost model. Thus, CareMessage is designed again as an annual subscription for transparency, predictability, and based off of the total number of patients in your organization. Byron did ask if the platform CM Lite is available to organizations that are non-medical, and did want to address that. Historically, CareMessage was only a solution designed for safety net providers, and really specifically federally qualified health centers and free and charitable clinics. In response to COVID-19, we actually have opened up our CM Lite offering to community-based organizations or ones that don't specifically deliver any medical services. Now, we, of course, would want to have a one-on-one conversation with those organizations to ensure that our platform is appropriate for the way that they want to use messaging specifically. But an example of what we've done since March of 2020, for example, has been to partner with a national food assistance nonprofit organization, and we have offered CM Lite to 25 of their local food banks. So something that we, of course, are happy to have a conversation about. And it looks like Stacy asked a similar question, so hopefully that addresses it. We have another question from Tommy asking, so CareMessage or messages will be sent to patients unless they opt out. Tommy, the way that our organizations think about messaging, and specifically for opt-in, opt-out, is the majority, if not almost every single organization using CareMessage and CM Lite, they do take the opt-in approach such that they will message their patients, and they will let their patients know that they have the ability to opt out at any point. And upon receiving that opt-out, will then remove, and CareMessage will automatically prevent messages from being sent. But you're correct in that health centers do typically, and I'll move to the FAQ, and I apologize, I believe I said opt-in, but CareMessage, we recommend the opt-out approach, meaning that yes, you can send messages to your patients unless they are explicitly opting out. We have a question from Jesse on if clients can submit pictures via text. As of today, it's not possible to send pictures or photos or videos via CareMessage because this is SMS texting specifically. So the way that we recommend our health centers for sending out videos or links is through the form of a bit.ly link, so that condenses a URL down and perhaps navigates patients back to an online resource, the way that Wes described. Brother Bill's doing this, but as of today, it's not possible for a patient to send a file such as a photo or a video. Thank you, everyone, for submitting the questions. We are happy to hang on for another minute or two for any last questions that do come in. And then as a friendly reminder, we will send out this webinar recording, the presentation deck, later this afternoon to all attendees and registrants. It will include the resources that we've talked about today, as well as the FAQ here. So we'll hang on for another minute or two to see if there are any final questions. one question coming in, who should they get in contact with if they are a non-medical nonprofit? Go ahead and you will be able to get in touch directly with me upon receiving the email from our team with this webinar recording. You'll also have access to our contact information, and we'll make sure that you get connected to the right point of contact here at CareMessage. And if it wasn't clear, my contact information and the ability to get in touch with our team will all be included in the email follow-up. Wonderful. Well, with that, a huge, huge thank you again to Whitney and Wes for sharing the work that they are doing. We appreciate your partnership, the commitment to your patients, and just taking the time to share your learnings and best practices with us and with our guests and attendees today. With that, thank you, everyone. Have a great rest of your day, and we look forward to being in touch.
Thank you. Take care.
Thanks for having us. Have a great one, everyone.